Next of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of September 23rd, 2020. Proceedings are being made available via the House of Commons website. And so that you're aware, the webcast will always show the person speaking rather than the entirety of the committee. We have with us this evening an experienced group of parliamentarians and witnesses, so I'm going to spare you all of the repetitive detail and just remind you that when you're speaking, your mic should be open, and when you're not, it should be closed. Please address all comments through the chair. Pursuant to Standing Order 81 sub 4 and the order of reference of Wednesday, September 30th, 2020, the committee will continue our consideration of the main estimates for the fiscal year ending March 31st, 2021. And pursuant to Standing Order 81 sub 5 and the order of reference of Thursday, October 22nd, 2020, the committee will now also consider the supplementary estimate B for the fiscal year ending March 31st, 2021. I will now call vote 1B under Canada Mortgage and Housing Corporation, which will permit general discussion of the supplementary estimates B and questioning of witnesses. It's now my pleasure to welcome our witnesses, the Honourable Philomena Tassi, Minister of Labour, and from the Department of Employment and Social Development, Gary Robertson, Acting Deputy Minister, Labour Program, Anthony Giles, Assistant Deputy Minister, Labour Program, Policy, Dispute Resolution and International Affairs Directorate, Brenda Baxter, Acting Assistant Deputy Minister, Labour Program, Compliance Operations and Program Development Directorate, and Mark Perlman, Chief Financial Officer and Senior Assistant Deputy Minister. Madam Minister, you have 5 minutes for your opening remarks. The floor is yours.
Well, thanks, Mr. Chair, and good evening to you and to members of the committee and to the officials who are joining us this evening. And thank you for inviting me here this evening to be with you. So I'm thrilled to be able to join you virtually from the traditional territory of the Haudenosaunee and Anishinaabe peoples within the treaty covered by the Upper Canada Treaties, as well as the Dish with One Spoon Wampum Agreement, to discuss main estimates and supplementary estimates B for Employment and Social Development Canada's labor program. So this year, the department main estimates present a total of $68.6 billion in planned budgetary expenditures to carry out its mandate during the 2020-2021 fiscal year. More than 94% of this amount will directly benefit Canadians through the department's programs, services, and initiatives. We are proud of the work we do to help Canadians build better lives for themselves and their families, and to be resilient in facing the challenges. Now, as you know, the Government of Canada took a number of extraordinary but necessary steps to protect and support Canadian workers and businesses during the ongoing COVID-19 pandemic. To make sure that employees in federally regulated workplaces would be able to take time off work to deal with situations related to COVID-19, like school closures and self-isolation, the government introduced a new job-protected leave under the Canada Labour Code. We also waived medical certificate requirements to access certain existing leave. In addition, the government took action to protect the employment of employees in the federally regulated private sector. New measures gave employers more time to recall employees who are temporarily laid off due to the pandemic. This gives workers a better chance of staying connected with their organization and puts employers in a better position to restart or start growing their business as we transition out of the pandemic. This is a big part of building back better. As well, the government temporarily extended the eligible wages period for the Wage Earner Protection Program by up to 6 months. We did so to ensure that any delays in insolvency proceedings due to the pandemic did not harm or hurt or compromise the workers' eligibility for that program. Moreover, throughout the pandemic, we have been reminding employers of the importance of having an evergreen hazard prevention plan. That leads me to my portfolio supplementary estimates B. The department is requesting $0.4 million related to supporting business resumption for federally regulated employers. The COVID-19 pandemic has created challenges on many fronts for workers and employers in Canada. An effective business resumption requires focused occupational health and safety efforts, including addressing mental health. That's why the labor program will increase proactive occupational health and safety activities, outreach and guidance, as well as enhanced technical and mental health expertise to support business resumption in the federally regulated sector. In fact, the government recently announced that the Canadian Centre for Occupational Health and Safety will receive $2.5 million over 2 years to continue the excellent work they have been doing to provide COVID-19 resources to the workplaces. This funding is part of the coordinated efforts by federal, provincial, and territorial governments, public health authorities, and CCOHS to ensure that businesses have the necessary tools to protect their employees. One of the key pieces moving forward is ensuring workplaces are both safe and equitable. That is why we are implementing the Pay Equity Act, which introduces a proactive pay equity regime that will ensure that people working in the federally regulated workplaces receive equal pay for work of equal value. This unlocks people's productivity, creativity, and enthusiasm because they know they are being paid justly. Quite frankly, we have told our children that women and men are co-equals. It's high time that our legislation indicated that we practice what we preach. In fact, I am sure future generations will find it bizarre that this debate was ever had. We are also raising awareness of wage gaps that affect women, Indigenous people, people with disabilities, and visible minorities in the federally regulated workplaces through new pay transparency measures. Now, as you know, we've passed legislation to help prevent violence and harassment in the workplace. We will soon move forward with implementation of this legislation and regulations, which will come into force on January 1st, 2021. Workplaces are evolving even faster now due to the pandemic. Mental health is a key element of occupational health and safety. That's why we will consult and work with unions, workers, employers, and experts to further improve support for mental health for workers. Mr. Chair, these are just some of the actions we are taking. There's no doubt that the financial resources requested under these main estimates and supplementary estimates B will enable us to continue this work. These efforts we are making, which connect things we are already doing with our direct response to COVID-19 pandemic, are all part of our government's plan to build back better for all Canadians. I'm now pleased to take your questions.
Thank you very much, Minister. We're going to start with Mr. Kent for the Conservatives for 6 minutes. You have the floor, sir.
Thank you, Chair, and thank you, Minister, and thanks to your officials for attending this evening sitting. As you mentioned, along with the extraordinary steps taken for Employment and Social Development Canada's labor program, several of the COVID emergency support programs have required harmonization with provincial and territorial labor laws and codes. So to start off, can I ask you, have the provinces essentially given you, the federal government, carte blanche in terms of these programs and the new programs as they evolve?
So the collaboration piece is extremely important. So at the very beginning of this, I convened a meeting with my provincial and territorial partners, as I have with unions, labor and industry, in order to work together. And as a result of those meetings, it gave an opportunity for people to express what the concerns are. One of the main issues that came through in those meetings was the concern with respect to standards or guidance to keep workers safe. That's been my number one priority as Minister of Labor, is occupational health and safety. So in that regard, what we did is we reached out to the Canadian Centre for Occupational Health and Safety, and the provinces and territories were very happy about that because it enabled a resource to provide guidance with respect to moving forward. So they have done sector-specific tip sheets, an informational sharing portal, e-learning resources, and the like. in order to ensure that that was available to provinces and territories in the sectors, in all of the sectors, so that would help keep workers safe.
Now, speed was obviously of the essence. Many of these programs in normal times would have taken months, perhaps even years to develop. Can you share with us any of the tougher decisions that you had to achieve, or some of the differences that had to be resolved early on? And I know in the rush, some gaps appeared, some things had to be corrected. We had special sessions to catch up, but how smooth has this harmonization gone?
Well, MP Kent, I would say that, you know, I have been very impressed with the level of collaboration, like people coming together of the spirit of really wanting to work together to protect workers and ensure that they are healthy and safe across the board. You know, I've been in this portfolio for a year, but to see that level of collaboration was absolutely fantastic. And I want to really commend CCOHS because they created in record time, their team turned those sector-specific tip sheets around. And I know they were working around the clock. So that transition was smooth. I think that the idea was that we needed to have those in place as a guide, so that was important. And the other area, of course, was the mental health piece, which was also something that was shared as an area of concern, that, you know, supporting workers, occupational health and safety also includes mental health in all of our minds. So, but what I would say is the level of collaboration has been absolutely fantastic.
Okay. Now, there was obviously no time for anyone on the federal side to meaningfully liaise with the provinces when C2 became C4, rewritten at the 11th hour in September as a result of the confidence votes concessions to the NDP, which included the 2-week paid sick leave. Now, I've heard in recent weeks concerns from some Ontario small businesses that the paid leave provisions are so broad, they fear, they haven't yet experienced, or at least no one's told me they have, but they fear possible future unwarranted absenteeism. Have the provinces accepted specifically the 2-week paid sick leave, which overrides some provincial private sector sick leave provisions, or are you leaving provinces to decide whether it applies or not to the private sector?
So I have not been the lead on that particular part of the file. I would say this, that in discussions with provinces and territories, it was clear that some provinces more than others, I think, were really advocating for this 10 paid sick leave provision. And everyone agreed that we did not want workers going to work if they felt sick. I mean, that would just put people in a position where trying to contain this would be very, very difficult. So everyone agreed with the principle that if someone felt sick, we wanted them to have the opportunity to stay home. And as you know, so that was part of the $19 billion transfer that we would make with the provinces and territories. But with respect to the actual particular terms of that, I believe that's the Deputy Prime Minister and Minister of Finance that was the lead on that, together with Minister Qualtrough. So specifically, we agreed in principle with the idea and wanted to support workers and give them the ability to stay home, so they didn't have to think that if they did that they wouldn't be able to pay their bills or put food on the table.
How's my time, Chair?
You got about 15 seconds, not enough for a question and an answer. Thank you very much, Mr. Kent. Yes, thank you. Next, we have Mr. Long, please, for 6 minutes.
Thank you, Mr. Chair, and good evening, Minister. It's great to see you. I hearken back to our days where we sat together on HUMA. I am obviously coming to you from the beautiful riding of St. John Ross, located on the unceded territory of the Wolastoqey peoples. So, Minister, you know my riding, and you know the strong labor component to the riding. And I just wanted to touch base and talk to you a little bit about pay equity and ask you some questions on that. Like we've seen over the course of the last 9 months, the consequences of COVID-19 pandemic. It's been more severe, obviously, for some Canadians than others. In fact, the pandemic has highlighted a variety of systemic inequalities that need to be addressed. Now, Minister, you know my riding and the wonderful labor leaders in it, like Darlene Bembridge, Kara Vanderbeck, Angela Campbell, Maureen O'Haron-Lang from Public Service Alliance, Aaron Howell-Sharp, who you've met with from Unifor, Tammy Nadeau and Sharon Tier from CUPE. And, you know, obviously we work with them daily and hand, but when it comes to equal pay of equal value, according to recent data, women earn 89 cents for every dollar earned by a man. In 2018, our government put forward and Parliament adopted a revised Pay Equity Act, and recently draft regulations were released and consultations will run until January 13th, 2021. Minister, can you tell the committee what these regulations will mean for Canadians when they come into force?
Well, thanks, MP Long, and nice to see you virtually. I do remember the days on HUMA, and they were good days. Yes, so this is, in my view, this is transformational legislation, because it's not just about giving men and women equal pay for a job that's the same job. This is about giving women equal pay for work of equal value, and that's the transformational piece. And so we know that that when women can count on equal pay for work of equal value, that there's not only a moral imperative, it's not only the right thing to do, it's the smart thing to do. Our economy is going to grow stronger. So we have been moving forward with this. We think it's very important. We have appointed the first pay equity commissioner, Karen Jensen, and her team are working now on materials and resources for employers, because we want to make this a transition one that is going to be easy. So I know her and her team are working very hard. I've had a couple of conversations with her. And then on, as you have said, on November 13th, they were published in, the regulations were published in CG1. There is a 60-day consultation period now. It's really important that we hear from stakeholders, because we don't want to just get this through fast. We want to do it the right way. So there is a 60-day consultation period. And then with this feedback that we get after the consultation period, we will, of course, be moving forward and putting it in CG2. And then, of course, hopefully with a coming into force date later in 2021.
Hey, thanks for that. Minister, obviously, I appreciate the response and agree with you, obviously, that it's important to move forward with pay equity. However, there are detractors that will question why you are pursuing the implementation of the Pay Equity Act now, given that our economy is still working to recover from the pandemic. What are the advantages, Minister, of moving forward now?
So I appreciate the question and the concerns that some are raising, but I think it's really important to take a look at what we are doing here. This isn't, as I have said, it's not just the right thing to do. There is a moral imperative to do this. And I said in my opening remarks, women should be receiving equal pay for when they are doing work of equal value. But the second part is the economic benefit. And the economic benefits have proven themselves. Over the last 40 years, the greater participation of women in the workforce has resulted in about 1/3 of Canada's economic growth. And there's estimates that Canada could add $150 billion in the next decade by taking steps towards getting more women in the workforce. So this is something that I think is I'm happy it's a priority for the government. We're going to continue. We know that that this is going to benefit all Canadians. I'm very confident that Karen Jensen, as the commissioner, is going to do a fantastic job, and we look forward to bringing this act into fruition.
Thank you. And Chair, how much time do I have left? Chair?
1 minute, Mr. Long.
Okay, thanks. Minister, last question. In addition to bringing into force pay equity measures, you're moving forward also with pay transparency measures. I understand that making this data publicly available will help identify the wage gap experienced by women, Indigenous persons, persons with disabilities, and visible minorities in regulated, federally regulated workplaces. These are clearly important measures given many of the inequalities that have been highlighted during the pandemic. Can you explain quickly what the benefits are of these measures?
So absolutely, we're committed to reducing the gender wage gap, and this is going to do that. With respect to this is going to cause the result of this is going to be that pay is going to be transparent for the 4 groups that are subject to this. So women, Indigenous peoples, persons with disabilities, and visible minorities. And this is going to provide Canadians with really a user-friendly availability to see where the gaps are. And then, of course, the result is going to be that the employers are going to respond to those gaps by making efforts to correct them. So this is another measure that we think is important in moving forward. Getting rid of that wage gap is going to encourage women and the other groups in terms of continuing in the workforce, and we want to do that because we want everyone to have an equal opportunity.
Thank you, Minister. Thank you, Mr. Long. Suite, c'est le tour de Madame Chabot.
Now, Ms. Chabot, for 6 minutes, please. Thank you, Mr. Chair. Madam Minister, it's a pleasure. I hope that you're doing well. Now, of course, I'd like to ask you about wage equity, but I'll come back to that. Well, we know that in your mandate letter, the one that was given to you after the election, includes putting in place a minimum wage of $15 an hour for people who work in sectors under federal jurisdiction. Now, the crisis hit us, and the essential workers and our guardian angels, who we've heard so much about, are often the salaried workers who are at the bottom of the ladder, the ones who receive the least. So this mandate that you have, well, I think that it's really critical now. So my question is, well, in the main estimates, there were amounts that were supposed to be dedicated to that and adjustments made to the labor code. But where are you at with this minimum wage of $15 an hour? Thank you, MP Chabot. Thank you for this question.
To see you, and thank you for the important question. This is, as you can appreciate, my focus, of course, has been on occupational health and safety, ensuring that workers are kept safe. The pandemic has presented, of course, a lot of challenges, but there are other commitments in my mandate letter, and I think that COVID-19 has absolutely demonstrated the importance of us moving forward with the $15 federal minimum wage. This was a commitment that we made during the campaign, again, then reaffirmed in my mandate letter. And we want to make sure that we get this right. But I agree with you absolutely that we have a lot of workers who are, packing our groceries, serving, stocking shelves, keeping us safe during this time. And although the federal minimum wage would apply to federally regulated workers, this is an opportunity to show leadership, and I am committed to maintaining this as a priority as we move forward.
Merci. Thank you. I have a question on the workplace equity program. The main estimates indicates that a grant of $2.3 million is dedicated to the funding program for the workplace, and if I understand, this is for projects that are connected to occupational health and safety and workplace equity in the sense of access to employment. Can you tell us which project is connected to equity for women, equity for employment, not for salaries?
Okay, so just for clarification, if I may, are you talking about the $2.5 million for the Canadian Centre for Occupational Health and Safety? Is that the fund that you're referring to?
No, pardon, madame. No, pardon me. $2.3 million for the employment funding program, which seeks to give financial help to organizations so that they come up with initiatives that are related to equity and occupational health and safety. I think it includes occupational health and safety, but there's also an employment equity portion.
Officials just to get clarification with respect to the actual number and what is going to what program. So Gary, I'll refer to you in a minute for that. With respect to employment equity, you know, it's my strong opinion that everybody deserves a fair chance to succeed. And with respect to women in the workforce, you know, with COVID-19, I think we saw some advances prior, but there's more work to be done. There's no question with respect to the promotion of women. So when we look at initiatives that the federal government has taken, like the passing of Bill C-65 to prevent violence and harassment in the workplace, the proactive pay equity legislation, which I just spoke about, pay transparency, the commitment with respect to childcare, and then the $5 billion that Minister Ng has talked about with Women Entrepreneurship Program. I think all these are going to help encourage women to be in the workforce. But I agree with you 100% in saying that we all benefit when we increase women in the workforce.
Merci.
Thank you. I imagine that I have no time left, Mr. Chair? Or do I have time for a last short question? 1 minute left. Well, I was surprised, Madam Minister, that you answered, if I understood correctly, that for wage equity, it would be by the end of 2021 that this project will see the light of day. Why so long for the implementation of a new bill that received royal assent?
Okay, so this is a very good question. And so I'm not indicating the time in 2021, but that it will go through in 2021. But I think that the important point here is that we absolutely have to get this right. And this is transformational legislation, as I have said. And you're not looking at work that's the same work. You're looking at a different job. So as Ms. Jensen has explained to me, to take different jobs and to compare those jobs and then to come up with a formula that's going to make it so that those jobs of equal value are going to be paid, we have to approach this in a manner where you know, we're going to bring employers with us, we're going to provide them with the tools, and we're going to have the consultation prior to the implementation date to ensure that we are hearing from all stakeholders in an effort to get this right, because we have a real opportunity here, and I want more than anything else to make sure that we get this right.
Merci, Ministre. Merci, Madame.
Thank you, Madam Minister. Thank you, Mrs. Chabot. Now over to Ms. Gazan.
6 minutes.
Thank you so much, Mr. Chair, and thank you so much, Minister, for joining us today. It's really nice to have you here. We know before COVID, people were left behind. I'm talking specifically about BIPOC individuals, persons with disabilities, women. We know that this has been occurring. We certainly know it's been exacerbated by COVID. And I think we can assume that those that were left out before will be worse off after COVID. So I know that in your opening comments, you spoke about raising awareness of the wage gaps that affect women, Indigenous people, you mentioned, people with disabilities, invisible minorities in a federally regulated workplaces through new pay transparency measures. Other than raising awareness, because we know that we need immediate action to address gross, inequalities, but also systemic racism in the workplace. Other than awareness, we need more than awareness. What are some concrete actions you are taking to end discrimination for women, Indigenous people, disabled person, and BIPOC persons? And as part of this, inequalities in terms of wage, is your government considering a guaranteed livable basic income?
Okay, so thanks for that, MP Gazan. That there's a lot in that question.
A lot.
So if I
Big
miss some
problem.
of it when we come back, maybe you
Yeah.
can go through. So look, at pay transparency is there so that there's public listings of the wage gaps that exist between the different peoples that are identified that we have mentioned. And I think that that's important because it's demonstrating to employers that have those wage gaps that more needs to be done in order to address those wage gaps, that those wage gaps should not be there. We know they exist. So now this is going to be made public. It's going to be open for everyone to see, and the employers will have the responsibility to do things to correct that wage gap. In terms of other areas where we can do more, I agree with you that we absolutely have to do more. For me, in terms of employment equity, I would like to see the playing field leveled or the floor raised, depending on how you view the issue, so that everyone has a chance to succeed. Because when we do that, when we give everyone a chance to succeed, we as Canadians all benefit. We know that when we can allow people.
Thank you so much. But what are you going to put in place to make sure that we level the playing field and that everybody can succeed?
So those are measures that we're doing through pay equity. So that is going to have women compensated equally to men. Pay transparency, so that the gaps that exist are going to be corrected. C65, prevention of violence and harassment in the workforce, because we want to ensure that people at work are comfortable and they're not being in any way targeted and not feeling safe. Mental health is a part of occupational health and safety. All these measures that we are taking are going to make the workforce fairer, and we hope more open and transparent. So those are some of the measures that we are taking. Is there more work to do? Absolutely. And I look forward to working with you as we take on those measures.
Sure. Thank you very much. My next question is, how many times, Minister, have you met with unions regarding occupational health and safety concerns related to COVID-19 to date? How many times?
So to give an exact number on that is extremely difficult, but I will say that every day I'm talking to labor, reaching out to industry, labor, my PT partners. These calls are going on an ongoing basis, but have had many conversations with union leaders with respect to issues that are of a concern for them.
Okay, and you mentioned, and I was happy to hear you mention this, you focused on including measures to address mental health, because we know the mental health, certainly particularly of frontline workers and essential workers during COVID, has been hard hit, and certainly understandably. But we also have seen during COVID, the treatment of workers, particularly those in food production, including migrant workers and newcomers, that have been subjected to employers who during the COVID-19 pandemic have shown a complete disregard for their safety, well-being, and human rights. And I can think of the outbreak, for example, in Manitoba at the Maple Leaf in Brandon, and many others, including places in Ontario. And many are wondering why they have been, many have been during the outbreaks, have been in, for example, meat processing plants, and many who are low-income workers and BIPOC. I was wondering if you could speak to whether your department is addressing this and what you will be doing in relation to the high number of COVID outbreaks in food production to better protect workers going forward.
Yeah, great question. So what I would say is that, as I've said before, occupational health and safety and the safety of workers has been my number one priority, and that has been the focus. It's fantastic that we have organizations like the Canadian Centre for Occupational Health and Safety that are helping us so that they can say, okay, food processing, here's the standards, here's the guidance that you should follow in order to keep workers safe. But I also want to point out here that we do have to acknowledge the difference between federal and provincial jurisdiction. So so we are putting supports in place like that investment with CCOHS to ensure that workers are safe and do what we can in order to support that. And every worker has the right to a safe work site. In the federal jurisdiction, If a worker feels that their work site isn't safe, then they can make that claim and they will not be forced to work there. The labor program will go in, do an assessment, determine if the work site is safe or not. And if it's not safe, then the employer has to fix that site and get it up to standards so that it is safe. So those are the measures that we are taking in order to keep workers safe.
Thank you, Minister. Thank you, Ms. Gazan.
Oh, thank you.
We're going to go to Ms. Falk, please, for 5 minutes.
Thank you, Minister, for being available to the committee today. Long-term care homes in Canada, we know, have bore the brunt of this health crisis. And in my capacity as Shadow Minister for Seniors, I have had the opportunity to meet with many individuals and groups representing frontline healthcare workers in long-term care facilities. So the conditions that have been described in firsthand accounts are dire and are not unique to any individual home. And while many of the challenges in long-term care, in the long-term care sector, were pre-existed COVID, they are exponentially heightened by this pandemic. And immediate actions are needed to safeguard the health, safety, and the well-being of long-term care residents and the staff who care for them. One of these urgent and serious challenges is a sector-wide staffing crisis. And in the supplementary estimates, there's an allocation of just under $12.5 million in funds for personal support workers, training, and measures to address labor shortages in long-term and home care. So, Minister, I'm just wondering, how are these funds being used to address the urgent labor crisis in long-term care?
Okay, thank you, MP Falk, for that important question. So I will say that, we're very aware and very grateful for the workers that are in long-term care facilities. And I want to say that I have spoken with Charlene Stewart, who's the lead of the SEIU, and she has explained to me, Linda Sellis as well, explained to me the concerns with respect to the issues for long-term care workers, both with respect to the safety piece, also with respect to the burnout, and the need to ensure that we have more long-term care workers. So this actual provision that you're talking about is under Minister Qualtrough's jurisdiction. I know that there is funding money that has been set aside to specifically help train or is going to be used to train PSWs and long-term care workers.
So do you know if that's been used at all, especially just because we're in the second wave? And I mean, this definitely needed to be addressed before yesterday, right?
Yeah.
So what is the government doing? I mean, there is 12.5 million just under that allocated for this. So I'm just wondering, I mean, it's something, like I said, that should have been done before yesterday.
So what I would say there is I can ask my officials if they have information on that. As I've said, it's Minister Qualtrough's portfolio with respect to that funding. But I don't know if either Gary or Tony, you have something that you'd like to say.
I'm wondering if Mark Perlman maybe has a comment from the CFO perspective.
Thank you for that. So the funding is there. As of the end of September, I don't believe a lot of funding has been spent, but the whole purpose was to recruit up to 4,000 new personal support worker interns.
Well, it's unfortunate though. Training. It's unfortunate though because people are dying, seniors are dying in these facilities. And most of this is because of a staffing shortage that the PSWs, especially in Ontario, have been very loud about. That they need that manpower. I mean, when we look at the average care that's needed for residents in long-term care, the average is 4 hours a day, and in Canada they're getting 2.6. It's absolutely unacceptable that the people that built this country are not being made a priority. That being said, Minister, I'm just wondering if you have advised your officials at all to look at the opportunities to leverage existing labor programs like the Sectoral Initiatives Program, SIP, to address the shortages of staff in long-term care.
Okay, so listen, first and foremost, I agree with you that we absolutely owe a debt of gratitude to those that are working in long-term care. and that we want to make investments in terms of ensuring that we have those that are able to scale up and get the skills that they need in order to take on these roles, because these roles are very important, and seniors at the end of their life, we absolutely owe them everything, and we should be doing whatever we can in order to ensure that they are properly cared for.
Absolutely. So if the money wasn't used under the fund allocation that was specific for PSWs, have you asked or directed your officials to look in other avenues to make sure that we could get staffing in long-term care facilities?
So
short answer, please, Minister. We're out of time.
Okay, so you're asking me questions that are under Minister Qualtroux's portfolio. So the workforce development piece and training, that's all under Minister Qualtrough. So we're happy to get back to you with answers and details with respect to that, but we would be actually reaching out to her ministry in order to get those answers.
Absolutely, thank you. I would hope the government would work as a whole. So thank you.
Next, we're going to go to Ms. Young, please, for 5 minutes.
Thank you very much, Mr. Chair, and thank you to Minister Tassi for giving us this time tonight and for the officials from the department. Minister Tassi, you and I have talked about mental health issues and on a number of occasions prior to COVID. We know how important it is that people recognize that a part of health and safety is mental health. And so I was very glad to hear that that you're doing even more, that your department is doing more. Canadians are, of course, facing unimaginable pressure because of COVID, and whether it's professionally or because of finances. And these stresses are going to linger a long time. And you talked about that the government is committed to mental health. Can you, I'd like to drill down and understand what you have undertaken and what you are planning to do in order to address mental health concerns of workers in all sectors.
So thanks, MP Young, for that question. And you know that mental health is an area that is extremely important to me. And I'm happy that you've raised the question. Look, COVID-19 has absolutely taken a toll on emotional, psychological, and a social toll on all Canadians. With respect to the mental health piece, when I convened the meeting with labor and industry, it was one of the areas where there was an express concern with respect to the mental health obstacles, challenges that workers were facing. And so as a government, it was the Minister of Health that introduced this Wellness Together Canada website, which is a good website because you can actually reach out to that site and portal, and you can get an assessment rate to talking to someone. So I think that investment was really, really important, and one that I know that all Canadians can access, but workers can access it as well. I would say that the CMHC has put out numbers. 500,000 employees each week are unable to work because of mental health challenges, illness, or issues. And the cost is to the economy, they say $6 billion a year. That's what they are saying. And so I'm happy to see that mental health as a part of occupational health and safety is something that is included in my mandate letter. I look forward to moving forward with this particular mandate item because I think that mental health is absolutely a part of our overall health. And so we have to take workers and ensure that they are getting the mental health supports we need. And again, this is another thing where it is a smart investment. In fact, there's 10 of the Canadian largest companies have reported that for every dollar they have spent on mental health, they've in return received $1.62. So this is an example of an investment that is a worthy investment. It's an important investment. It's a much needed investment. And at the end of the day, employers will gain and benefit if their employees have the mental health supports that they need.
And I don't want to state the obvious, but you say that we don't want workers to go to work if they feel sick. And I imagine you include that to be your mental health as well, because there are people who are actually afraid to go back to work right now and will be over the coming months and possibly years.
Well, I believe that mental health is a part of our overall health, and this is why it's important that we as a government provide supports and resources. So in this area, again, the Canadian Centre for Occupational Health and Safety has provided materials. The Mental Health Commission of Canada has also provided materials. And I think that these are really important investments, because if our employees are healthy and well, we know that employers are going to benefit with productivity, with retention. So this is an area that I believe is extremely important, and I look forward to doing more in order to ensure that all workers are healthy and well and get the supports that they need.
And I hope, if I can just sum up, that the federal government will be a leader in this field, because I think if we can show other businesses that this is important, that they will take note and realize that they need to understand that mental health means so much to the overall wellness of Canadians. Thank you very much, Minister Tassi.
Thank you, Ms. Young. Suite, c'est le tour de Madame Chabot pour 2 minutes et...
Now, Ms. Chabot, 2.5 minutes. Thank you. Thank you, Madam Minister. We'll continue with the occupational health and safety and mental health. I know that beyond the pandemic, it's already a concern, and it was in your mandate letter. It was important for mental health to be an important element of occupational health and safety. I also know, well, in any case, you have been concerned with consulting unions about this. And I've heard about that in Quebec, even partners from the labor market. And this is my question, and you brought this up already. The matter of mental health. Well, you have a budget, but that mostly falls under measures that are implemented in each province. In Quebec, we have our governing body. And mental health is more and more important. Surveys show us that it's increasingly problematic for workers. So with an additional budget, how will you be able to coordinate everything being done in the provinces on that?
Okay, so thank you for that question. Very happy to have that question. So first, I think the federal government has demonstrated the importance of mental health. Prior to COVID-19, there was a $6 billion investment in mental health and providing mental health supports. Actually, now, sorry, I don't know if it was $5 billion for mental health and $6 billion for palliative care and home care. So I think it was $5 billion. Sorry, so I correct myself. $5 billion. So that demonstrates, and that's an area where normally, we're not giving specific money for mental health, but we knew the importance. COVID-19 has demonstrated even more, and as I've said, and I'm happy to hear that you're hearing that I'm engaging with unions, and I have heard that in my engagement with unions, that this is really, really important. In terms of in my mandate letter, including mental health as part of occupational health and safety, I think this is an important step forward. There is case law now that demonstrates that, mental health should be a part of occupational health and safety, of our overall health. I know that with respect to my mandate commitment, there is a discussion paper that is going out with respect to mental health and a survey, and that's going to be released very, very soon. Like I'm talking within the next, I think, 2 weeks. And that is an opportunity for us to get the information so that as we move forward, if we are spending money, if we are putting supports in place, that these are supports that are going to make a real difference in the lives of workers.
Thank you, Minister. Merci, Madame Chabot. Next, it's Ms. Gazan, please, for 2.5 minutes.
Thank you, Mr. Chair. And just the next question, I just wanted to speak a little bit about the sick time. I know the NDP fought really hard to get 10 paid days of sick time for anybody who was symptomatic during the pandemic. We know that this is critical if we want to contain the virus. Certainly a really critical health and safety issue. Pandemics will occur in the future. That's what they're predicting, unfortunately. And with this in mind, will the government be moving forward on ensuring a permanent 2 weeks of paid sick leave for every worker in Canada as a critical health and safety measure? I know many people want to stay home, but cannot afford to stay home, and that places them and others at risk.
So thanks for the question. What I will say is that, our government, through the $19 billion Safe Restart, it was understood that a portion of those funds were going to be for those 10 days that, yes, the NDP advocated for. And I think people agreed. You're absolutely right. If someone's sick, you don't want them going to work. You want them to be able to stay home. And in addition to that, I will say that under the labor code, we also allowed job protection for that time. So if someone is sick, they don't have to worry about, it's not only the financial support, it's also they're not going to lose their job if they're off, they're taking time, whether it's because they're sick or there are other measures that they need to take off because of the COVID-19. Moving forward, I would say that, listen, we're open to discussion in terms of how we move forward. The issue here really is that in this pandemic, we've had to work very closely with provinces and territories. This is provincial jurisdiction that we're moving into, and I think you can appreciate that. But I think that the pandemic has really demonstrated the collaborative nature, and we can continue to dialogue to determine how we can get to a place that is going to best support workers.
Just one final last question. We know that many workers have gotten sick during COVID, resulting in permanent physical health issues as a result of contracting COVID. In the spirit of being all in it together, is your government considering implementing a guaranteed livable basic income, particularly for those who want to work but can no longer work as a result of the pandemic?
Short answer, please, if you could, Minister. We're out of time.
Okay, so MP Gazan, you'll be happy to know that I have said that a universal basic income is a progressive policy that needs to be looked at. I know it has support from all parties, each people in all the parties, and so it's something that I think that needs to be looked at. But having said that, I think that the supports that the federal government has offered now, there are so many different supports that we have offered to ensure that no Canadian falls between the cracks. So you've heard my position on it. I think it's something that needs further study to be considered.
Thank you so
Minister.
much.
Thank you, Ms. Gazan. Mr. Schmale, please, for 5 minutes.
Sorry, Mr. Chair, I'm actually up next. Me and Mr. Schmale decided to switch. Thank you so much. Okay.
It's all yours.
Thank you. Minister Tassi, very thankful to have you here today. You said in your opening remarks that the labor program will increase proactive occupational health and safety activities, outreach and guidance, as well as enhance technical and mental health expertise. That's related to, just for clarification, that's related to federal work sites, correct?
I just want to make sure that my official confirms that, but that's correct, right, Gary?
That is correct.
Yes. Yeah. Yes.
Okay. So I represent Mission Matsqui Fraser Canyon. I'm home to 4 federal penitentiaries. And I just heard last week that the Union of Canadian Correctional Officers who said in no uncertain terms that they deplore Employment and Social Development Canada's lack of transparency and seriousness when it carried out their investigation into the safety complaints related to COVID-19. If you're not aware, Mission was the home of the largest outbreak of COVID at any federal institution. How would you respond to my constituents and federal workers in that description of your department?
So I know, MP Viss, that you've raised this concern before, and I've heard you in the concern. look, at the end of the day, we absolutely want to ensure that every employee has a safe place to go to work. And that is and every employee has a right. It's the employer's obligation to provide a safe work site. If an employee goes to the site and the work is not safe, then they have the right to refuse work, and the labor program goes in and makes that investigation. And if at the end of the day it's not safe, the employer has a responsibility to make the corrections to the work site in order to make it safe.
And I agree with that assessment, but in some cases, Corrections Canada employees are frontline workers that are federally regulated, can't live up to that standard because they put their life on the line for the protection of our community. And when I hear from these guys that they don't feel safe going to their workplace and that they're asking simply for a professional firm to clean their facility, I think the department should take another look. And I'm just going to raise another point. They said that ESDC rendered their decision on COVID-19 only 3 hours after hearing from officers. How can they make a decision in 3 hours about COVID-19 safety protocols 3 hours after hearing from the frontline workers?
So listen, I hear your passion, and I absolutely want to say to you that we want every worker to be safe. Absolutely. And so in terms of this particular issue, my understanding is the labor program goes in and makes that assessment. I can turn to my officials to say if they have any specific details on this particular case, and the allegation that you're making that that you don't. It's
actually not an allegation. It's actually everything written in their press release that was published in the Mission City Record on November 19th. Those are not my words. Those are the words of federal employees. They say your department lacks transparency. They deplore the actions of your department and that you're not taking their health and safety seriously. I want to ask you today, are you willing to come to Mission and to meet with Derek Chin, other representatives from the union, and try to get this right? Because I can tell you the nightmare that those workers faced this spring. We had every inmate was practically infected in that facility, and the Corrections Canada did not do a good enough job of communicating with the public. There was even a child that got COVID-19 from their parent who was at the prison. So you know what? I really appreciated your testimony earlier, and I know what those words you were saying, you meant them. So in good faith today, will you come and meet directly with those? I don't even need to be there. But will you come and meet directly with those corrections officers to get these labor issues right? Because they need your leadership right now to do their jobs well. Can you provide that commitment today?
So what I would say to you, MP Vis, is I am going to continue to work as hard as I possibly can to ensure every worker in every place that's federally regulated is safe. If there's an issue, then of course I will look into it, and I will ask my officials to provide me with feedback with respect to what the concern is and what the response of the department is. But we absolutely, workers are entitled to a safe work site. There's a process.
They're not getting it though. They're not getting a safe workplace.
Mr. Viss, we're out of time. If you want to finish up your answer, Minister, and then we're going to go to Mr. Vaughan.
So MP Vis, what I would say is, listen, I've heard you loud and clear here. The commitment that I make is that we want to ensure that every workplace is safe. And if there are workplaces that aren't safe, there's a process that one goes through. If there's a concern with respect to that process, I've heard you. I will take what you've said back and have a conversation with my officials, but it's a right that exists. It exists in the Canada Labour Code. Every worker has a right to a safe workplace, and no worker is forced to work in an unsafe site. And if that's, if you're saying to me that that's not the case, then I will look into it with my officials.
It's not me, it's the federal employees.
Okay.
But I thank you for your input and for your passion.
Thank you.
I thank
Mr.
you
Viss.
for the exchange. It was actually very productive. Thank you.
And our final questioner for you, Madam Minister, is Mr. Vaughan, please, for 5 minutes.
Sure. Thanks very much, and good evening, Minister. Just wanted to check in to make sure we're clear on this, that the training money that was set aside to create new personal support workers that doesn't fall within your ministry, but that because you're part of a quartet of ministers in a similar department, that your officials may be able to get us answers to that question?
That's absolutely right. So I have no jurisdiction over that particular funding. Absolutely, we work together as a government, as a cabinet. We make decisions and we have discussions. And the support for this particular group is one that we absolutely want to ensure is there. But with respect to the actual oversight of the training and development and the money that's set aside, that's not my portfolio. That's correct.
And does your ministry work with provinces to develop the labor force agreements that sort of prioritize immigration patterns across the country to try to meet key labor shortages? Is that one of the things that your ministry?
No, that again is Minister Qualtrough.
And so, in terms of taking a look at, for example, how Quebec in 2019 focused on bringing in artificial intelligence experts and high technology experts, as opposed to fast tracking personal support workers, that would be the work of Minister Qualtrough if that
That's
decision
correct.
was to be made. And in terms of the issues that were raised by MP Viss about a complaint from frontline workers in a federal employment setting, in this case a penitentiary, in terms of those investigations, is there an appeal process to a complaint?
So my understanding, and I would like Gary to confirm, but my understanding is I believe it is CIRB who is the appeal process, Canadian Industrial Relations Board.
That
So
is
if
correct,
there,
Minister.
okay, thank you. So if there is a complaint with respect to the process, then one can take that to the CIRB for a decision.
And are you aware of a complaint being lodged to the Canadian Industrial Review Board?
With respect to this particular,
penitentiary, was it raised beyond going to a headline in a newspaper? Was it raised through formal channels through the union to the review board?
I have not been made aware of that. It could still be in the process of coming to me, but as of yet, I have not been made aware of that.
Okay, if perhaps if we could get a report back as to whether or not a formal complaint has been lodged or whether it's just a complaint through the media, that would be helpful. In terms of the mental health work, the investments we made as a top up to the Canada Health Act, above and beyond the inflationary increase, those dollars are at the discretion of the provinces to spend. It's up to them to decide whether or not to carve them into workplace environments under provincial jurisdiction.
That is correct. Yes.
Is there a reporting mechanism for that allows us to figure out how provinces have spent those dollars in the healthcare sector, or is that largely left to their own devices to decide how to use those monies?
I can speak to my experience as Minister of Seniors with the home care and palliative care piece, and there are agreements that go back and forth, and there are sort of pockets but with respect to a detailed analysis, that does not take place. There is accountability to say this has been spent in this particular area, but this now would fall under the Minister of Health with respect to the terms of the mental health transfer.
So, for example, if we wanted to direct mental health supports to frontline workers, in particular those working in long-term care facilities, supportive housing facilities, doing work around addiction control, who have had a really difficult year this year with COVID and the opioid crisis, we want to get those details. It would be a conversation with provincial ministers that would produce the information that we're looking for, not simply a federal expenditure or a line item on a budget.
That's correct.
In terms of mental health support in the federal sector, are you seeing areas that we need to start to study or advocate for that would provide this committee with an opportunity to add to the federal government's initiatives around mental health? Are there suggested areas of study that you would like to see us work on that are related to your field of ministerial responsibility?
Well, I think for me, it's moving forward with the mandate item, which is mental health as part of an occupational health and safety. And yes, what supports work best with workers. I've had those conversations as I've spoken with unions and labor and employers to say what supports are needed. And some employers actually create their own support system and they pay for the system. And that is offered to the employees that they have in their sites. But definitely what supports are most beneficial. And some companies are actually making investments. Perhaps the value of those investments and the impact that the dollars have had would be helpful.
Thank you, Mr. Vaughan. Thank you, Madam Minister. And thank you so much for being with us. We're going to suspend now briefly to give you a chance to disconnect. And I understand we have a couple of other officials that are going to join us for the second hour. So, Minister, thanks again for being with us. Always a pleasure to have you. And we hope you have a wonderful evening, and we'll see you before too long.
Thanks, Minister.
Thanks so much. And I want to thank each and every one of you. I thought that was a very respectful dialogue. Appreciate the input, and always feel free to reach out. Thanks so much.
Thanks, Minister. We're suspended for 3 minutes. In addition to the witnesses that were introduced at the outset of the meeting, I would like to welcome one additional witness, Alicia Ram, Associate Assistant Deputy Minister, Skills and Employment Branch. We're going to begin now with rounds of questions, beginning with the Conservatives. I believe it's Ms. Falk, is it?
I believe it's MP Schmale.
Actually, Brad Viss. Sorry.
Oh, hot
We've
potato.
sent a
I'm up
flurry of
again.
emails
Okay,
to the
I'm ready to
clerk.
go. Okay.
Mr. Viss, for 6 minutes, go ahead.
Thank you so much. Okay, so thank you officials for being here. Can you comment on what the corrections union said? The Union of Canadian Corrections Union, the Union of Canadian Correctional Officers said in respect to the workplace safety investigations that your department undertook, and their comment that a decision was rendered within 3 hours of reviewing the situation at Mission Institution.
Yes, thanks for the question. So I guess I'd start off by acknowledging that the correctional officers, as well as others, such as the food inspection officers, work in very challenging environments in normal course of affairs. And certainly the current context makes that much more complicated. So I just did want to acknowledge that. Having said that, without getting into too much detail, what I could say is that it is, I think, true that a decision was made 3 hours or so after the inspector spoke to that particular individual. But the broader picture is that that officer had done additional work and had additional interviews and interactions with other folks in that employment context. So they did a complete review. And part of our process, because we're quite concerned about making sure we get it right in COVID in particular, there's always a program advisor, someone separate and apart from the officer, who provides them with advice and guidance and makes sure that they've considered all the various factors that they should in the current context before they render a decision. So I guess what I would say is I'm pretty sure that the process was followed. I take the point that a number of folks are concerned about the outcome of that. I would reiterate the point the minister made, which is there is an opportunity to appeal to the CIRB. And in fact, what I would offer is the Canada Labour Code was set up in part 2 to ensure that there was not undue political inference at any point during the process. So when the officer acts, they act on behalf of the minister. And once they do have a ruling, it's considered functus, which I wasn't familiar with the term before I fulfilled this role. But functus officio basically means once the decision's made, it is permanent unless it's appealed and overturned. So the CIRB really is the right organization to approach if there's a concern about the outcome.
Okay, thank you. Regarding personal protective equipment in federal institutions, I did write Minister Blair about certain labor issues on October 2nd, 2020. I have yet to receive a response, but one of the questions and one of the issues that federal union members raised with me were the protocol around PPE. As you will note, at the very beginning of the pandemic in the spring, there was not sufficient PPE in federal penitentiaries, and it was a big problem, and that's part of the reason why there was such a massive outbreak. Has the PPE policies been updated since the spring? And what measures are available to officers to enforce the mandatory mask wearing and social distancing in common areas?
Yes, thanks for the question. So what I would say is, I think it's clear to a lot of people that there's been a challenge with obtaining enough PPE for the present circumstances, particularly when a lot of it is produced out of country. So I do appreciate that Corrections was one of the institutions that had a challenge along with a number of others. In terms of the use of PPE, it is prescribed by the Canada Labour Code. And what I would share with folks is when we make decisions, we use the authoritative advisor or advisor organization to make those decisions. And so in our particular case, we reference the Public Health Agency of Canada. And in the absence of advice from them, we would go to the WHO, the World Health Organization. And what I would say is the guidance has evolved over time, but the guidance around masks, non-medical masks, just for a technical point, is not considered to be PPE. It's considered to be a public health measure.
I got to get one more quick question in there. Federal penitentiaries as well. I got 4 of them in my riding. There is also the need for broader public information to be made available to keep our community safe. In this instance, the Mission Institution is just a few kilometers up the road from where I'm at right now. And there was no federal protocols in place to ensure that the decisions being made at the Mission Institution were shared with the broader community. The only avenue I had as an MP were to ask questions and to go to federal officials myself and literally beg for them to communicate with the public. How have you as public servants in charge of labor policies improved, or are you making improvements to ensure that in cases where there is federal responsibility, that the broader public is being made aware of the decisions to ensure that they feel that they're being kept safe as well? Because our numbers in BC are only going up as it relates to COVID.
Again, thanks for the question. I guess what I would say is part of the Canada Labour Code mandates that every organization has a hazard prevention program and that it be kept up to date. And so within the corrections context, they would have 2 different mechanisms to ensure that was done in collaboration with labor. Because of the size of the organization, they would have workplace health and safety committees in the different locations. But because there are over 200 employees nationally, they'd also have an occupational health and safety policy committee. And so the operation of that policy committee should ensure that policies that relate to health and safety and in COVID in particular are portable and used across the country where they do apply to multiple institutions.
And I'm saying in this institutions, we need to do a better job of making sure that information is disseminated. I say that in good faith just to improve it for public awareness. Thank you so much.
Thank you, Mr. Viss. Next, we have Mr. Turnbull, please, for 6 minutes.
Mr. Chair, and thanks to all the witnesses for being here. Really appreciate the hard work you're putting in and probably long hours. The testament to your hard work is just being here this evening, late into the evening with us, and I appreciate the conversation. I have a couple comment or questions for Mr. Perlman. One to start off with is, could you just give us an overview of how COVID-19 has impacted planned expenditures within the labor portfolio? I think that would be really helpful for all of us. What's increased, what's decreased? Mr. Perlman, you're on mute.
Yeah, no, I understand that. I'm just wondering, because I look at overall at the department, maybe Mr. Robertson would be able to speak more directly to the labor program itself.
Sure. I'd be happy to. So there are a number of pockets where programming activity has changed quite dramatically. And so if you'll permit, I'll just cover a few of them. So one of them is in actually the Wage Earner Protection Program, which is a program we haven't covered yet tonight, but that provides compensation to workers who were terminated as a result of being associated with the company that's gone bankrupt or into receivership. And what I can tell you is, well, the number of bankruptcies associated with this program are actually down slightly from previous year. The number of individual applications have gone up. So what that means is more large companies have gone into bankruptcy or into receivership. More activity there than we normally would. That particular program normally has a statutory cap of about $49 million. But we've already close to 30 million compensating former employees in that capacity. And so we would project forward that we're likely to exceed that statutory cap, which is fine. If you meet the requirements, you get the money. So there's no challenge for the individuals, but that program has grown quite a bit. Another program is our Government Employee Compensation Act program. And there I can tell you that actually our volumes have gone down. So because the number of employees are working at home outside the workplace, in the first quarter of this fiscal year, we only had about 30% of our typical volume for that same period. In our second quarter, we only had about 60%. So there's been a precipitous drop, if I can call it that, in the first half of this year. If I turn to labor standards, what I would say is because of the initial adjustment period, we're only at about 92% of our monetary complaint capacity, but we're not far off of what it was last year. So there is a fair amount of work going on there. And in our occupational health and safety area, we've actually reduced the amount of proactive work that we have done historically fairly significantly. But our reactive work is still sitting at about 80%. And so that's driven principally based on complaints. So quite a bit of variation through the various programs as a result of that. In employment equity, which I didn't cover, the fifth program, we would have seen actually a delay in people submitting their reports, but we're not concerned about that. In our international area, there's still been a fair amount of work with our colleagues, both in the provinces, as the minister's spoken of, but also internationally. And our federal mediation and conciliation service is still very, very busy assisting stakeholders in the employment context resolve outstanding challenges within their context. So I think that's a fairly broad coverage.
That's really helpful, Madam or Mr. Chair. Sorry. How much time do I have left?
More than a minute, less than 2.
Okay, great. The next question I have is related to, I think, the multiple streams of funding related to business resumption. I think if I'm reading it correctly, there's one through ESDC and then one through the Canadian Centre for Occupational Health and Safety. And it looks to me like the one through ESDC focuses more on inspections, compliance, and advice to employers. And so just wondering how much funding has increased from the ESDC side, and then how much it may have increased on the CCOHS side.
Thank you for the question. So what I would say on the ESDC side is we did obtain a commitment for a multi-year amount for ESDC labor program, which will total $2.5 million. So in SUPS B, you'll notice almost $500,000 of that, which is the first tranche. And it's because the money will come late in this year. So we'll have about a quarter of full activity and then 4 quarters of full activity next year. CCOHS is also receiving or about to receive $2.5 million for activities that they'll undertake nationally and on behalf of all jurisdictions. And again, they're receiving about 1.3 million of that this year, with the balance to follow in the subsequent year. And the one element that doesn't pop out to you in the estimates as they're profiled here are actually Transport Canada is also receiving just short of $200,000 this year and a balance of $800,000 next year, for a total of $1 million, to do the same type of work that the labor program is, but in the 3 modes of transportation that they're typically responsible for.
Thank you, Mr. Turnbull. Mr. Robertson, suite Madame Chabot pour 6 minutes, s'il vous plaît.
Ms. Chabot for 6 minutes. Thank you. Good evening, everyone. Well, you partly answered some of my questions, because I had questions on the Wage Earner Protection Program, and the minister spoke about it as well. She talked about extending the timeline. So I understood that you said it was a budget that had a limit, to confirm if I've got that right. But our concern is that because of COVID, it's been evaluated that there may be a lot more workers that turn to this. Just in Quebec, 18,000 SMEs might go bankrupt. And then there's the issue of protecting the pensions, but this is not included in the Wage Earner Protection Program. So are you able to tell us how many workers enrolled in the program because of the pandemic this year, or because of bankruptcy? Were there more than usual? Do you have the number? Yes, thank you for the question. In fact, I have the number. Give me just a moment. I'll give you a minute if it means I don't lose a minute. I believe that the number is approximately 9,000 people to this date. But I am trying to verify that. Perhaps I can ask if Brenda has the exact number. But I think it's about 9,000. Brenda? Did I give the right number?
So we've just had over 9,000 applications this fiscal year.
Et comme j'ai dit, bien sûr, si...
And as I said, thank you. So I understand that the limit could be extended if the effects of the pandemic keep increasing. Yes, you're right. Thank you. My other question has to do with a question I asked the minister. Maybe I wasn't clear. I'll ask it again. It has to do, I'll also find the right page here. It's the program that I was asking about with 3 streams. There's one for occupational health and safety. There's a $2.3 million. Then there's an employment equity piece. That's equity for women. So my question is, that 2.3 million, or was it billion? Well, that would be more logical. Are these amounts broken down by program? Is it possible to know the amounts given for the projects that have to do with women and employment equity? Thank you again for the question. Yes, of course. In the documents, we have a reference to $2.3 million. about 500,000 is for activities around employment equity. Now we have a big project with Ryerson University.
Work to the tune of about $500,000 over the life of the project for work that is expected to inform that particular area. The autre montant
The other amount, about $1.7 million, is dedicated to international activities. That's in line with our commitments with our international partners. And if you have any further questions about this amount, Tony's available to answer those. Thank you. Out of curiosity, for businesses under federal jurisdiction, are there programs for access to employment? Are there requirements for organizations or businesses under federal jurisdiction to put in place policies around employment equity to make sure that minorities or women are included? Yes. The law requires every organization under federal jurisdiction to submit a report each year and identify their progress. And with that approach, that makes the situation clear to all Canadians. They can see if there's been progress or not in each of the fields. Thank you. One last question. Very, very quickly, please. Is there money in the budget to go forward with the minimum wage at $15? Has any amount of money been put aside for that? A quick response, please. As the minister said, there is a plan to implement that in the near future. Thank you, Ms. Chabot.
And please, for 6 minutes.
Thank you so much, Chair, and thank you, all the witnesses for being here today. I know that you've been working really hard, as all of us have during the pandemic. My question is actually about child care workers or early childhood educators. Although I know that it's overlapping jurisdictions. Many childcare workers, in terms of conditions that really are conducive to meeting proper health and safety measures, are non-existent. We know that childcare workers are essential. Childcare workers allow families to go to work, particularly women who have been really hard hit by the pandemic. Yet in the province of Manitoba, I'll give you one example. We recently had to return all the masks because they did not meet health and safety standards, and these masks were provided by the province of Manitoba. This is horrific. It's not only unsafe for workers, it's unsafe for children, and it places family at risk. I'm wondering if your government has any plans, or your department has any plans to put measures in place to put in place national standards to protect childcare workers.
Thank you for the question. So 2 parts to my response. One is, at the federal level, we are having discussions with our colleagues in the provinces and territories about common approaches. Well, I know you're aware that we don't regulate childcare and early childhood learning facilities. What I would say is CCUHS, which the minister referred to a number of times, has been developing information and guidance for those contexts. And just to give a little bit more about CCUHS, because it's one of our unknown gems nationally, it's got a governance body that's comprised of employee reps, employer reps, and each jurisdiction is represented on the council, or has an ability to be represented on the council. So when they do provide guidance, it is something that resonates with everyone, not just us at the federal level. So the work they've been doing really has been well appreciated. And I know when I talk to my colleagues from the jurisdictions, they very much appreciate it. On the last part around the PPE, because I did hear that part, and it is a theme that we've heard in a number of different contexts. What I would share with you is there was been a recognition early on that this was going to be a challenge nationally, and Public Service and Procurement Canada actually has been facilitating bulk purchases of equipment that are available within the different jurisdictions and within the different sectors. As they obtain it, it is made available. So I would share that with you because it is another initiative that the federal government has undertaken.
Yeah, I see. I mention it because not only are early childhood educators grossly underpaid, they're often not respected, and these jobs are primarily comprised of women. And if we're going to talk about equity in the workforce, then I think we need to target resources, particularly in employment that is occupied mainly of women. And that includes early childhood education. Thanks very much for your response. My next question has to do with individuals living with compromised immune systems. I have several constituents in my riding that have compromised immune systems, and their workplaces put them at higher risk, of course, because it's a pandemic, but they do not have the right to refuse unsafe work for this reason. They can't say, I'm not going to work because I have a compromised immune system. And your government allows for Canadians in this position to only receive 2 weeks of the CRSB, which isn't a solution that puts these particular individuals with compromised immune systems at risk. What is your department doing to protect immunocompromised workers during COVID-19 pandemic to make sure that their health is not put on the line to survive?
Thank you again for the question. So I will turn to both Tony and Alicia to help support the response. But I think what I would say to start is that every employer has a duty to accommodate folks with physical or mental challenges. And so immune challenges are a challenge, a health challenge like any other. And so while there are approaches that we've taken to help address this, it's not exclusively through this mechanism that folks should have these conversations. So Tony and Alicia, can I turn it back to you?
Thanks, Gary. I can just say briefly from a labor policy point of view that the government recently passed legislation providing job-protected leave for all employees with any kind of COVID-related concern, well beyond the 2 weeks that are actually paid by the new benefit.
Does that, sorry, I just have a question in that. Does that include pay or just leave? Most people can't afford to have a leave without pay.
That's right.
Yeah, go ahead.
No, it doesn't. The labor code provides unpaid job-protected leave.
Thank you, Mr. Giles, and thank you, Ms. Gazan. Next, Mr. Kent, please, for 5 minutes.
Thank you, Chair, and Mr. Schmale will take this slot. Thank you.
Mr. Schmale.
Thank you very much, Chair, and thank you to our witnesses for their contributions here. With respect to the Wage Earner Protection Program, does your department keep track of how many companies have declared bankruptcy or have gone into receivership since April 1st of 2020?
Yes, so we do track the number of folks that have had challenges in this space. And as I was saying before,
I didn't hear. Sorry, can you repeat that? It just went.
Oh, I'm sorry. Maybe when I twisted
on me.
Okay, so yes, we do track the number of organizations that access the WEP program as a result of bankruptcies. And as I said before, it has gone down. I believe there are 83% of what we had experienced last year that have declared bankruptcy and come through our program, which is less. But as I had mentioned before, which I find quite interesting, the number of folks, individuals that worked for them is higher, which means more larger organizations have gone bankrupt than smaller or mid-sized organizations. So that's the only explanation for that strange dichotomy.
Okay, I appreciate that. I don't know about anyone else. It was in and out, the connection. I think I got enough to understand what you said, but I don't know if anyone else is having the same issues.
Would it be helpful if I restated?
Is that okay with the chair? Some of it was robotic. Peter Kent's waving too. Okay, maybe just that last little bit. It just went silent. If that's okay with you, Chair.
Yeah, by all means. I'm not having any trouble with the sound quality, but if you are, you want to hear your answer, go ahead, Mr. Robertson.
Again, my apologies. So my understanding is year to date, like that goes up to the end of September. That's when we most recently tracked. The number of bankruptcies we've had is 186 versus in the same period last year, we had 223. So that represents 83%. So it's less bankruptcies than normal. But during that same period, the number of individuals associated with those bankruptcies went from 7,900 last year to over 9,000 this year. So the number of individuals that have benefited from WEP's gone up by the tune of 15%. And what I want to say is last year that we're comparing it to was an unusual year. We had very high volumes last year. So the volume to date is about 1.5 times our normal annual volume.
Okay. It must be my computer if everyone else is hearing okay. Do you know, can you tell us if you have these figures handy, how much money has been paid out to cover the outstanding wages to employees as a result of COVID-19 shutdown?
I don't have the exact number. I will turn to Brenda in case she does. But what I do know is the average payment is between $4,000 and $4,500 on average. But she might have the precise number. Brenda, any chance that that's the case?
I'm sorry, sir. I did not hear a word you said. And Peter's waving his hand too. Peter Kent's saying he can't hear either.
Me too.
Okay, so I'm going to try again. I had stated, and again, I apologize, that I don't have the precise total number, but I do believe that the average payment for the individuals that have accessed it is somewhere between $4,000 and $4,500 each. But Brenda, if you could confirm that, it would be helpful.
So the total that's been paid out as of September 30th this year for the fiscal year is $29 million, just over $29 million to recipients, monies that were owed to them.
Okay, thank you. Can you tell us how the shutdown of Service Ontario during the early months of the pandemic affected the clarity of information required by employees to require for the WEP?
I can comment that actually it wasn't a large challenge for us in this particular program. Service Canada does manage it on our behalf, but what happens is the bankruptcy folks or the trustees actually administer most of the calculations. They provide the packages in final format to Service Canada, and then they process it. And so we have a service standard of 35 days. And this year we're meeting it 99% of the time. So we're feeling like the payment frequency and timeliness is pretty high this year, even though the volume of individual applicants has gone up.
And Mr. Schmale, you're out of time, but you had some technical difficulties. Please ask one more question if you have another.
Oh, thank you. If I could, I just had technical difficulties on that last little piece, but I was able to read your lips, and I think I got my answer. I don't know about anyone else who might not be, watching on Zoom or CPAC or another platform. About Service Canada, about the closures. I think many MPs across Canada had to kind of pick up where Service Canada left off when they shut down. Can you just give us a number of, if you were aware of, how many Service Canada offices are still closed?
Yeah, I actually don't have that information because it's not something we manage within the labor program. But in the unlikely event that either Alicia or Mark happens to be aware, I might turn to them.
Yeah, I can answer that. So out of our 317 Service Canada centers, out of the 317 Service Canada centers, 300 of them are now open, and we currently have plans underway to reopen the remainder. The whole intent or the purpose is to make sure that we're opening them safely with the right social distancing, personal protective equipment, and guard services to be able to manage the traffic in and out, to ensure that that the safety of our employees is maintained, as well as the safety of our clients.
Okay. I need a headset like that. That was clear as a bell. Okay, thank you, everyone.
Thanks for hanging in there, Mr. Smale. Mr. Dong, please, for 5 minutes.
Well, thank you very much, Chair. I also would like to thank all the witnesses for joining us tonight. Yeah, I heard, I listened, and I heard you said safety and well-being of our employees are very, very important, and that's absolutely true. In my riding, I reached out to employers and workers on the front line during this COVID pandemic, and I've heard that they're being very innovative, following the rules, protecting their employees, keep social distancing, allow employees to work from home and support their work at home, which is great, but it's still very, very challenging. So with regard to the Canadian Centre for Occupational Health and Safety, can you tell us the step that you've taken that speaks directly to the concerns of Canadian workers and employer, especially during the COVID, because nobody was really prepared for it. So everything has to be learned and executed in a rather quick fashion. So could you tell us some of the steps that you've taken?
I can, and what I should do is be clear. While I am currently the acting deputy minister of the labor program, in addition to that and separate from that, I also happen to be the chair of the council for CCOHS. So it's from that perspective I'll respond. But what I would say is they've undertaken a significant amount of work to ensure that people were well positioned to respond, again, in all sectors and across all jurisdictions within Canada. They've issued a large number of tip sheets. They have a significant amount of training material that they've released for free, which is normally for charge. And I can tell you it's running into the hundreds of thousands of dollars, but there's not a person on council that has a concern with that because it's understood what a benefit it is to workers across the country. They've actually advised a number of folks, including the court systems across Canada, on their reopening so that they could do those successfully. And I think we'll have all noted that that actually happened without too many hiccups, which was quite great. And they've also established MOUs with a number of organizations like PHAC so that they can operationalize information that's of a public health nature for an employment context. Excuse me?
Yeah, okay, we have a point of order. Is it Ms. Falk?
Yeah, I'm having a very hard time hearing the answer. It's very choppy and coming in and out. I don't think I could say I heard any of his answer.
Okay, this is strange because I know the clerk tells me that in the room they're not having any trouble. For me, it's clear as a bell. So
I'm in the same boat.
Choppy. Sorry. I can't hear as well, Chair.
Okay. It's bouncing in and out. It sounds like an open channel.
Okay.
Point of order, Mr. Chairman.
Yes, go ahead, Mr. Housefather.
I was just wondering, you and I are probably listening. I hear it perfectly. We're probably listening on floor. And I'm guessing some of our colleagues who are wanting translation are listening on English or French, and they're probably hearing it on those channels while we on floor don't hear.
You're right that I am listening on floor. Is to Mr. Smale, Mr. Viss, Ms. Falk, Mr. Vaughn, are you on floor or on English?
Yeah,
okay.
English.
I'm now on English too. I'll switch.
Yeah, I'm on floor now.
Okay, thanks for that suggestion, Mr. Housefather. So let's try that. Of course, if you require interpretation, and you still don't, and you're not getting it, make sure you raise a point of order. We absolutely want people to hear. Okay, so Mr. Robertson, I think you were in the middle of an answer when we and folks, again, as Mr. Robertson takes the floor again, please let me know if you're not hearing him. So if you could go back to that last question and take another run at it, that would be greatly appreciated. Thank you.
Yes, please. Certainly, and I appreciate the time, and I'm sorry for the technical challenge. So
it's
again,
not you.
I hope it's not me. I happen to be the chair of CCOHS, so I have some visibility into their operations from that perspective. And what I would share with you is they've done an extraordinary amount of work to issue tip sheets that are helpful to all jurisdictions and all sectors, not just those that are federally regulated. They've actually released for free a large segment of their training material. And it's in the tune of hundreds of thousands of dollars, the value of that, to ensure that people have access to timely information that will help keep them safe. And they've established MOUs with a number of key organizations or large organizations that have the ability to influence COVID prevention measures, such as PHAC. So they've done quite a bit. And the one example I gave, or I intended to give at the last point, was they actually provided advice to the court systems across Canada when they were doing their business resumption so that that could be done safely. I think under the leadership of a number of justices, it went extremely well. And it's a very complex environment when you think about all the moving parts. So they've been quite active, and it's something that we're really quite proud of.
That's great answer. I heard earlier there was a mention about $2.5 million in addition being invested this year to strengthen the contribution of CCOHC. Someone would consider that an amount to be relatively modest when we listening to billions of dollars invested to support business and individuals during the pandemic. So I was wondering that if you could outline how this investment is going to improve your reach and your ability to support the needs of Canadian economy, both during the worst time of the pandemic as well, doing a targeted recovery going forward, the $2.5 million.
Yeah, thank you. So yes, so for the 1.3 this year and the 1.2 the subsequent year, they're hoping to do significantly more advisories, tip sheets, directions, guidance, and most importantly, additional training capacity to ensure that as people do retool and return to the workforce or re-return to the workforce, that they're doing so in a safe context. So a lot of good work going on. I agree that it sounds like a modest amount, but I can tell you they get full value for the dollar.
Thank you, Mr. Dong, and thank you, Mr. Robertson.
Thank you.
Madame Chabot pour 2 minutes et demie.
Ms. Chabot, 2.5 minutes. Thank you. I'm going to ask a broader question around work. We know that the departments have been separated. We've got social development, skills development, and the others. But there are still some job-related things that concern us, and I'd like to know what you think about that. For example, there's the aerospatial and aeronautics sector. If we don't want to miss out on expertise of these workers in this field, well, we know that there were some major job losses. So how are you working in collaboration so that we can put in place strategies that are more broad? And another question that was in the minister's mandate letter, how do you work with other bodies for a transition for workers towards a greener economy? Because the solutions will be through workers. we can't talk about a transition without talking about workers. So how are you addressing this at your department? Thank you for the question. For the first part of the question, I would say that we have worked very hard with the aerospatial sector, despite the fact that our proactive level of activity has diminished. But in that sector, our activities have increased almost by 80% compared to last year. So we're aware of the challenges in that field. And we've decided to work harder and support this sector. Now, for the other part of the question about the transition, we have put in place a number of initiatives to minimize the likelihood of somebody being let go. The idea was to extend the period during which a person can be laid off, and that initiative created a situation where a person could keep their job with their employer for a period of 9 months. So those are the two initiatives and the two parts of your answer. Thank you, Ms. Chabot.
2.5 minutes.
Yes, thank you very much. I'm wondering, moving forward, we know that in many places, as a result of the COVID outbreak, workers are becoming sick with COVID because they are not provided with proper protection or are not provided with budgets to properly support staff. I'll give you an example. Currently in our shelters in Winnipeg, shelters that are all housed within my riding, we have a COVID outbreak. Workers are working around the clock, and these organizations and shelters and frontline organizations are doing everything in their power to keep people safe, including now having to shut down our only detox because too many staff have gotten sick. Is your department willing to work very closely with provinces to develop national standards for work health and safety, particularly in light of COVID, and particularly with an understanding that this is probably the first of many pandemics to come? Workers deserve to be safe. This is currently not happening. Thanks. If you could respond to that. Thank you.
Yeah, thank you for the question. I think the way I would respond to this is back in late October, the Canadian Standards Association issued a press release that indicated that they were going to set up a testing and certification center in Canada to ensure that we had better capacity nationally to access PPE that met our requirements. I can tell you the labor program is linked into that. We're not responsible for the initiative, but we're playing a role as a stakeholder. And that is an initiative that will benefit all provinces and territories equally as they set up that capacity and they have the ability to offer those services.
Just given the serious nature of this, and we know that many workers getting sick from COVID-19 are workers that are involved in care industries, whether it's healthcare, frontline organizations working with people with diverse needs. What is the timeline? We know that we could be in this pandemic for a few more months. Many people have lost lives caring for others. What is the timeline your department is proposing to put in this training to make sure that people are safe now?
Short answer, please.
Yeah, so the CSA would want to comment on their own timelines, but what I can tell you is the CCOHS training materials, which would in part address your question, are expected to start being developed very, very shortly and should be available in 2021.
Thank you, Ms. Gazan and Mr. Robertson. Next, Ms. Falk, please, for 5 minutes.
Thank you, Chair. I just had a question for Mr. Robertson, I believe. I'm interested regarding business resumption for federally regulated employees, and I'm interested in the type of information that is being given. Is this by CCOHS? Is this where these tip sheets that you are referring to would fall under?
They would for CCUHS, but if I responded on behalf of the activity that the labor program is going to undertake, what we'll be doing is principally focusing on the key elements that will contribute to the most benefit based on the work that we do. And so the key elements would be to make sure every organization that we link with is fully aware of their obligations related to the hazard protection program. And so we'll have very clear guidance for them and be able to support them if they need to update that. We'll equally be working with them to ensure that their occupational health and safety committees and policy committees, if they're large enough to have those, are operating effectively, because again, this will only work if the employers are working with employees to address the fundamental issues.
So what does that guidance look like?
Well, the guidance, many employers should have had biological hazards in their HBP, but many may not have. And so we will be working with them to make sure that they understand that needs to be included as it relates to COVID specifically. And we'll actually have industrial hygienists who are positioned to give them detailed advice as it would relate to their particular sector. Because as you can appreciate, it would be very different for someone working for an airline, working in an airplane, versus someone working in a telecommunication cabling tunnel. So they both are kind of limited spaces. I won't call them confined spaces. In some parts they may be, but there would be different variations. And so that's the type of activity that we would be doing. And if environments have struggled with their collaboration between their committee members, we would be in a position to help support them in identifying the key issues that they'd need to have the best dialogue around.
Okay, thank you. Just referring to the CCOHS line item of $1.3 million, I'm just wondering if you could tell us how many employers have received information, training, and education from them.
I don't have the statistics, but I could certainly ask Anne Tenier, who's the president, to provide those, and we could forward them through to the committee. I think you'd find that it's a fairly significant number in both cases, both instances. And what I'd expect is it will increase dramatically as they bring online the new capacity.
Okay, and do you know if they, or if there is a procedure in place to measure the success of the rollout of that?
They will, they do surveys with the people that use their products. I'm not sure to what degree they've kept that up because they're very overwhelmed right now and they're focused on the delivery. But again, I can check with Anne and ask her to provide the information. I was part of a discussion just short of a week ago where they went through some of the statistics, and it was pretty impressive, particularly on the training front, with the number of folks that were accessing their services. And at a minimum, I know that they've tracked the regional distribution across Canada, and it is fairly pervasive across Canada in all the different jurisdictions.
Oh, perfect. That's awesome. It's good to hear because we do know, especially with COVID and this pandemic, it has really shown the differences regionally that even rollout of programs has. I know I'm in a rural riding and we've had great problems with even just Service Canada closures, the office closures, and the lack of rural internet and being told to apply for programs online or whatever it is, go for information online. And a lot of these people don't have access to that. So it's good to hear that that's being noticed. And Mr. Chair, that's all that I have.
Thank you very much, Ms. Falk. Finally, we're going to go to Mr. Vaughan, please, for 5 minutes.
Thanks very much. And to Mr. Robertson, just to be clear, your department, while it sets up safety protocols and employment standards in federally regulated work environments, you don't actually manage the individual complaints between an employee and employer until it's raised to the formal processes that you have governance over. Is that right?
Yeah, what I would say is the normal refusal to work process requires an employee to approach their supervisor with the issue. If it can't be resolved there, they go to the Occupational Health and Safety Committee. And if the committee members can't come to a conclusion that's suitable to everyone, then it becomes a formal complaint to the labor program. And at that point, we have a formal role.
So in relation to the complaint that Mr. Viss highlighted, you'd be unaware of the fact that Minister Blair, for example, didn't respond in writing, but took the extraordinary step to include both him and the MP from Abbotsford, Mr. Fast, in a telephone call with the Commissioner of Corrections, an extraordinary step that normally doesn't ever happen, but that instead of writing a letter, they actually put them in touch with the person overseeing the corrections facilities and the complaint process therein. You wouldn't be aware of that because it wouldn't have been raised to your attention?
Yeah, it wouldn't be associated with our department's correspondence, so no, I would not be aware.
Under the same vein, you would be unaware of whether or not Public Health Canada issued directives to the provinces around safety standards in shelters and on frontline services serving vulnerable populations, especially in congregate living. You'd be unaware of whether or not Minister Hadjiu had actually issued directives and guidelines to provinces and to municipalities and to Indigenous governments around the operation of safe shelters. You wouldn't know that because unless a complaint was forwarded to you under your jurisdiction, you wouldn't have carriage of those standards being set or distributed to provincial governments?
That's correct. The only awareness I would have is what tip sheets the CCUHS has issued. But yes, you're right. From a complaint perspective, I wouldn't have visibility into that.
And you wouldn't have jurisdiction to impose standards or on provincial governments like the provincial government in Manitoba vis-a-vis health standards for frontline workers in the municipal or provincial health shelter system.
That would be correct.
Okay. And in terms of Service Canada, it's good to hear that we continue to make progress on that on reopenings. My understanding is that the centers that haven't been reopened, the small percentage that haven't, it's been entirely because of health and safety concerns raised by workers that have prevented those openings. That and a secondary problem, which is the inability to hire security guards to manage crowds accessing Service Canada. That those are the two major hurdles. Would you be aware of those as being the challenges?
I would maybe turn this one to Mark Perlman because he's responsible for accommodations in the SDC and would be more aware than I would be.
Yes, Mr. Chair, that's exactly the reason behind it is to make sure. And there's also the configuration of some of our smaller centers where it's just very, very difficult to find the 2 meter distancing to keep the safety for everybody out there.
So the only concern was much like the concern raised by Mr. Viss around workers inside federal penitentiaries. Workers inside Service Canada shouldn't be subjected to unhealthy or unsafe working conditions.
Point of order.
Go ahead, Mr. Viss.
It wasn't my concern. It was directly quoted from
Mr. Viss. That's not a point of order. We're into argument. He's allowed to ask those questions. Go ahead, Mr. Vaughn.
The article that he quoted, to be fair, it wasn't him who did the investigation or found this issue. It was reporting of an article and the conversation he had with a worker there. But the goal here inside Service Canada is to keep workers safe, the public safe, and to manage a process as best as can based on physical limitations that an office might have. Is that not the criteria?
That is correct. That is absolutely correct. And we have also made sure that we've had enhanced cleaning, plexiglass, hand sanitizer, masks, gloves, as well as appropriate signage and wayfinding. So it's all about making sure that everyone from all angles are being protected.
And despite that, we've got close to 90% reopened, but we also have staffed up the call centers at Service Canada with additional personnel to take the overflow, even though we're close to 100% now of reopening.
Yes, sir. We have done that, and we have also expanded our e-services offering to be able to compensate for the in-person service.
And are we still looking to hire commissaires or security personnel to help facilitate the opening of the remaining few? Is that a job offer that's gone unmet so far?
We are doing contracts with various organizations to try to find the appropriate people in the various locations.
All right, but again, the paramount directive here is to make sure when we reopen safely, both for the public and for staff, to make sure that we don't inadvertently, as we help people get through the COVID pandemic, deliver COVID to them. That's been the prime focus here.
That has been our focus.
I have no more questions.
Thank you very much, Mr. Vaughn. Thank you, Mr. Perlman. That concludes the time that we have for questions. I want to thank all of the officials for being with us, at least here on the East Coast, well into the evening. Thank you for the work that you do serving Canadians and parliamentarians. Extremely helpful. I wish you all a good evening, to my colleagues and to all of the support people that make it happen. Thanks a lot, everyone. Have a good evening. If there's nothing else, I think we're okay to adjourn. All right. By consensus, we are adjourned. Good evening, everyone. Thank you.
Bye-bye.
Thank you.